Hi, my name is EJ Loy, and I work together with my pharmacy classmate Brandon Groenhagen and our preceptor Dr. Van Klauenberg to gather and present this data. So this study was originally conducted for a research elective Brandon and I attended, and Dr. Van Klauenberg was a pharmacy professor that taught some of our classes, and she's also working at the Avera Medical Group in Brookings and was interested in doing some research into Paxlovid being dispensed there and its outcomes. So Brandon and I opted to join her in finding and analyzing the data. So back in late 2019, the coronavirus happened and it caused a worldwide pandemic. It became a big topic in healthcare and society overall. Because of how fast it spread and the ability to mutate, a lot of researchers and scientists were pushed to come up with a new treatment for it as soon as possible. One such treatment was Paxlovid that was granted emergency use authorization by the FDA in December 2021 and became the first oral treatment for COVID since the start of the pandemic. So Paxlovid is actually a combination of two different medications. One of them is nirmatrelvir, a medication that helps stop the viral replication of COVID, and the other one is ritonavir, which helps boost nirmatrelvir's concentration. So when Paxlovid got released, a lot of people questioned its efficacy and safety, partly due to the short turnaround time for its approval. So our study aimed at assessing Paxlovid's effectiveness in treating COVID, specifically looking at preventing hospitalizations or use of supplemental oxygen within 28 days, which was the same primary outcomes the Paxlovid clinical trial looked at to prove its efficacy. Our study design was a retrospective single-arm study where we looked at patients' charts and data gathered and de-identified from Avera Medical Group in Brookings, South Dakota, and Avera McKenna Hospital in Sioux Falls, South Dakota. So we looked at data from December 2021 when the Paxlovid got its emergency authorization up until September 2022 when the COVID bivalent booster came out. Of the 136 patients we looked at who received Paxlovid, only one person was hospitalized for COVID and one other person required supplemental oxygen. So we compared our data to the Paxlovid clinical trial and the Reina and Iglesias trial to see if there's any statistical difference between our group and their control groups and their placebo groups, using Fisher's exact test to compare the groups. So when comparing our group to the control groups of both trials, we saw that there was no statistical difference between them. When comparing our group to their placebo group, we did find statistically significant differences between them, which aligns with the data showcasing Paxlovid's efficacy. Also looking at two subgroups in our study, those over 60 and those under 60, each group had one case of supplemental oxygen use or hospitalization, and tolerability in cases of adverse effects were similar between the groups. Thus we could say that Paxlovid was equally as effective and tolerable in those over 60 compared to those under. So our research reinforces Paxlovid's efficacy and safety and applies it to a setting such as Brookings. Thanks for taking a look at our data and listening.